Good evening. I am Tricia Crowley of the League of Women Voters of Champaign County. On behalf of the League of Women Voters and the NAACP, I welcome you to tonight's Candidate Forum. Tonight's forum is for the primary election, and it's the Democratic ballot for the office of Champaign County Coroner. This is for the election on March 19, 2024. The forum will be available on vote.champaign.org, which is the League's candidate guide, and also on the League's YouTube channel, both of which can be found on the League's website, LWVCCounty.org. I'll be the moderator for this forum. Michelle Cooper is our timekeeper, and Ann Panthan, our Zoom operator. The order for starting is alphabetical, therefore Lori Brower will open and Sean Williams will close. And each candidate will be given 2 minutes for an opening statement. I'll then ask questions and each candidate will have 1 minute to answer these questions. At the end, each candidate will have 2 minutes for a closing statement. Candidates will kindly refrain from any negative attacks on the other candidate and will not mention the other candidate by name, will speak only to what they plan to do if elected to office. Shall we begin? So, Ms. Brower, you have 2 minutes for an opening statement.
Well, I'm so grateful for the chance to address the League of Women Voters and to share why I'm the most qualified candidate for Champaign County Coroner. This is a very unique job that my life has uniquely prepared me to be successful in. My broad experience in the coroner's office, in healthcare, and in customer service all come together perfectly to build a resume to be the next Champaign County Coroner. I'm both well qualified for and very passionate about my job, having planned to run for this office for the past 2+ years. I've been in the office long enough to know what is and isn't working. I have the perfect blend of institutional knowledge and experience from outside the office to understand the importance of being transparent, efficient, and compassionate. I'm a lifelong resident of the county. I was raised in Tolono, and I've lived for the past 30 years in Urbana. I'm married to my husband of 27 years. We have 3 adult children and 1 beautiful granddaughter and 5 dogs. I have pictures of the kids and the granddaughter and the dogs, if you anybody wants to see. My family is immersed in public safety locally. My husband has experience as a firefighter, an RN, a paramedic, and emergency manager. My one son works on the critical care transport vehicle ambulance, and the other son works as an EMT and is finishing up his paramedic training. I have brothers, uncles, a parent, and a grandparent who've all worked as police officers. Public service is part of my family's DNA. And this is a huge focus on my motivation of why I want to serve the residents of Champaign County as the next coroner. Thank you.
Thank you. Mr. Williams, you have 2 minutes.
Yes, ma'am. Happy Valentine's Day to you guys and the Women League of Voters. Thanks for the opportunity. My name is Sean Williams. I'm a lifelong resident of Champaign County. I spent 6 years in the military. I came back, started a business, been in the business community for about the last 30 years. And my business experience also allowed me to start doing public service work. I've been in public service since I've been 17 years old. And so serving the community is what I do. Being involved with executive positions throughout Champaign County, working with different leaders throughout the community, and finding out the intricate things that we need to be able to do to solve issues. I've been in the funeral home business for the last 13 years under the management and leadership with Tom Henderson, that was the coroner for 6 years. He worked for me for 6 years. And so that has allowed me an opportunity where I started finding out more information about how to compassionately serve the community. And so as coroner, I want to be able to address some of these issues that have not been addressed through our community coalition and other things that I feel as though the community need to solve a lot of issues to prevent people from making it to the coroner's office. So that's my opening statement. Thank you.
Thank you. Mr. Williams, we'll start with you for the questions. And as I said, we have 1 minute for each question. Can you describe all the duties and activities of the coroner's office for us? give our audience a kind of a picture?
Yes. So my immediate response for duties of the coroner's office is to determine the cause of death. I determine the cause of death for folks that have passed away, to compassionately inform some of the families that their loved ones have passed away, determine those cause of deaths, to gather either evidence or gather personal property, to be able to have death certificates signed in a timely manner, to be able to manage staff that they do the same, and yeah, and so those are some of the things that I feel as though that are immediate things that and to investigate those deaths, to make sure that they're properly investigated, and to be able to correspond with the interagencies, to be informed the community about immediate emergency needs. So yeah, that's my response to that.
Okay, thank you. Ms. Bauer, I'll repeat the question. Can you describe all of the duties and activities of the coroner's office?
So our primary concern is to determine the cause and manner of death. We do that by investigating the death. We'll do body removals. We respond to the scenes or hospital. We take death calls from hospitals. They're not all deaths do we have to respond to. We do collect evidence, and we do have to store that evidence. We can collect medications. We log all of this as evidence and store it for a certain amount of time, depending on what it is. We do the autopsies, and there are a lot of things involved in doing an autopsy, with collecting evidence, collecting specimens. One of the things that we do for the community is invalidate the driver's license of the decedent. So we fill out that paperwork with the state of Illinois. There's a lot of stuff we do that just is kind of behind the scenes stuff, but I think those are the big ones.
Okay, thank you. Ms. Brower, what prior experience have you had that has prepared you for this office?
Excellent question. So I am a licensed EMT basic. With that license, I've worked in the emergency department at Carl for 11 years. So I have a lot of healthcare experience. I've worked in small medical offices locally. I ran the EMS teams for the U of I. That includes all the sporting events, the vaccine clinic. When I came, I staffed the entire EMS division for that. I worked at the sheriff's department, and I've been in the coroner's office for 3 years now. I'm a licensed EMS instructor, and I did innovatively developed and led the first hybrid, the blended class during COVID for EMT basics. I don't know, that kind of unique career path kind of brought me to this office. Yeah, I am cross-trained in death investigation and autopsies.
Okay. Michelle, your sign is upside down.
Okay.
Okay. Mr. Williams, what kinds of prior experiences have you had that prepare you for this office?
So through my community service and my business experience with the funeral home business, I'm working with families on a direct basis every day. And so the experience of being a part of my funeral directors at an executive level, being able to orchestrate that for my funeral directors to be able to do removals, to be able to work directly with families, to find out their needs throughout the community, to be able to talk to these folk, find out to be able to help them, assist them with what happened to a loved one, and to be able to help them work with the coroner's office. And then I've done plenty of things with the coroner's office to be able to, for prevention. And one thing that I'm running on is prevention. How do we prevent young folk from being at the coroner's office? And so that's some of the things that I've been working with the community for a number of years with the coroner's office on.
Okay, thank you. Mr. Williams, what would your top priorities be if elected?
My priorities would be, first is education. I think if you know better, you do better. And so if I had an opportunity to be Champaign County's coroners, be educating folks on suicide deaths, the alarming the alarming number of suicide deaths we have, the opioid addictions, the heroin overdoses, everything that I've seen in the funeral home business and dealing with families, the amount of gun violence that we have. I think that if we can educate the community on those particular things. The second thing, diversifying the coroner's office. There's never been an African American in the coroner's office working, and there's never been folks in there that resemble what that coroner's office resembles to the community. And the third thing I would do is aftercare, estate planning, things that trauma support, those type of things that the community need to be able to deal with the immediate deaths that's happening throughout the county.
Okay, and this is a two-part question. What are the major obstacles to implementing those priorities?
Major obstacles. I think major obstacles right now for the Champaign County Coroner's Office is getting a new pathologist, and so some of those things that's a major obstacle for us because that was direct income that was coming in from other counties that we were supporting for years. The other major obstacle that I've seen that the coroner's office hasn't done is reach out to the broader race community. I'm a founding member of the Champaign Community Coalition. And so I've never seen the coroner participate with the Champaign County Community Coalition. And we started that to be able to encompass all non-for-profit organizations and all executive leaders to be embodied in one center location to be able to educate the community and give emergency response.
Okay, thank you. Ms. Brower, what would be your top priorities if elected?
Priorities. I think that we need to have better training with the staff to help improve the efficiency so that we can do our jobs a little bit better. Help, the families, some grief counseling and training. And education, I agree with Sean with that. We need more education out in the public. I would focus on the overdoses. We do have an opioid epidemic and an opioid problem in the county. Suicides, do stuff with suicide prevention, and infant deaths are kind of at the top of my list.
Okay. And what are the major obstacles to implementing those priorities?
I don't really see any obstacles with these. As a licensed EMS instructor, I think that I can provide training and or supplement it. Maybe a budgetary issue, with increasing needs might come with a budget adjustment, or, that might need to be done, or educational materials to talk to the public about, the different types of not preventable, but possibly preventable deaths.
Okay, so this is starting with Ms. Brower. As you're undoubtedly aware, the coroner's office functions with a very limited budget while working with the public in situations of great personal tragedy. What strategies do you have for improving efficiencies which can ensure death certificates are available as soon as possible?
That's definitely an issue. And I go back to training. Training the staff will make them more efficient. We do have a level 1 trauma center that services a third of the state here, and that increases our caseload. So the better training that we can have working with Carl, I have a really good working relationship with Carl, and help, kind of working together with them on how to make it more efficient for them also to report these deaths, and then for us to get these death certificates out signed faster.
Okay. And Mr. Williams, as you're undoubtedly aware, the coroner's office functions with a very limited budget while working with the public in situations of great personal tragedy. What strategies do you have for improving efficiencies which can ensure death certificates are available as soon as possible?
Well, making sure that we can first analyze all of the deaths that happen and do the investigations properly for all of the deaths that happen. But the ones that do not need the deaths, do not need all of the analyzation, then giving those folks those death certificates as quickly as possible. I know we have an issue with those being in the funeral home industry, being able to provide those to families for estate planning and those type of things to be able to move forward. How would I implement those things? I've already reached out to certain organizations and doctors that's a part of organizations to understand the dynamics of how we can work together with them to be able to bring more pathologists in our community, to be able to serve the community, and to be able to extend what our previous coroner has already done, is reaching out to those other counties and being able to serve those counties, so we can now obtain that revenue to be able to still serve other counties along with our own county.
Okay. And Mr. Williams, can you describe what the current staffing of the office is and whether the staffing resources that are necessary have been provided?
Let me understand your question.
Mm-hmm. Can you first to describe what is the current staffing and whether you think that staffing level is adequate?
So not knowing the intricate details as my opponent does, because obviously working in there, you'll be able to get a bird's eye view but just from me coming in over the last 13 years, obviously more hands on deck, more better the service, right? And so if we can get our county board to get more people on hand, then we can better the service. Obviously, you don't want to overwork people. So I have a couple different ideas about trying to take the stress level off of the folks that's already working in those positions. And that would probably be the 24 hours days working, and then maybe the next day off, or 2 days on and then 3 days off. But we have to get in there. I would have to get in there, see what the staffing is like, see what the temperament is of the people, and then be able to adjust as needed.
Okay. And Ms. Brower, what are the current staffing? What's the current staffing of the office, and do you believe that that's adequate?
Yes, so we have a medical secretary who serves as our secretary and receptionist. There are 5 deputy coroners, a chief deputy, the coroner, and right now we have 2 part-time autopsy techs. We're not doing autopsies in our county. We are doing out-of-county autopsies, and they staff those. For our county autopsies, they are utilized to transport the bodies to other counties to perform those autopsies. Do I think we're adequately staffed? No, I don't. That's been an ongoing issue that no one's wanted to address or try to fix. Obviously, I work in there. I know what kind of schedule we need, what would work for a person, and have that ready to go.
Okay. So so we're starting with Ms. Brower, sorry. What do you hope to accomplish if elected?
Something I hope to accomplish is to better serve the community. Obviously, Sean and I have both talked about this. There's an issue in delays with getting the death certificates out. That is a fixable issue. I'm going to go back to training. I'm a firm coming from healthcare. Training is key. Training, consistent training, ongoing training. And that, I think, will help with the staff morale and better serve the community.
So Mr. Williams, what would be your top priorities if elected?
Definitely top priority is educating the community and informing the community about the increase in deaths that we've seen. Prevention. My top priority is to prevent people from visiting the coroner's office as a client. That's been on my radar for quite some time. This opportunity allows me to now get in and try to diminish the amount of deaths, the increased deaths that we've been seeing in Champaign County. And so definitely educating. I'm with my opponent in training. I'm a military vet, and training is always one of the strong points of being able to serve at any capacity. So knowing what you're doing and being able to perfect what you're doing on an everyday basis. And obviously working on budgeting issues and those type of things to be able to help serve the citizens of Champaign County the best way we can, and leveraging relationships that we already have in place to be able to leverage those relationships to better serve Champaign County.
Okay, thank you. And Mr. Williams, it has recently been suggested by the county executive that the coroner's office be abolished by referenda and the duties assumed by a medical examiner. What is your position on this issue and why?
Well, the coroner's office is a non-biased entity. I was at that meeting, and I'm strongly against, whether if I get elected or not, I'm strongly against abolishing that. The coroner's office has been in existence since the early 1900s, and we've been building this coroner's office brick by brick since then. We expanded to where we are now, and I think that we should increase the capacity of the coroner's office and not misuse the spirit of the law to manipulate the law into diminishing the coroner's office or getting rid of the coroner's office.
Thank you. And Ms. Brower, do you want me to repeat the question?
No, I get it. So I wasn't completely opposed to the idea. What my thoughts were is, whatever's best for the county, if that's the direction that it needs to go. My issue was the lack of time, time. They didn't really have time between this proposal and wanting to get it on the ballot to really do the research. One of the reasons that they stated was budgeting money. It would be cheaper. And really, if you look at the numbers, it wouldn't really be cost effective. But really, I just felt like it really needs to be looked at. The coroner's office does need to be unbiased. So there would need to be some kind of plan in place to make sure that was that state, like that you could do this, without a bias and being able to determine the cause and manner of death. But I felt like they needed more information.
Okay. I guess I next have a couple of relationship questions. So Ms. Brower, what do you think should be the relationship between the county board and the coroner and other county officers?
I think that it should be a nice cohesive relationship. I think that their communication is key, and that whether or not you agree or disagree, you should be able to talk about things and be able to explain your pro or your con, or vice versa in dealing with the county board. I think it's a great system, the checks and balances that the county board provides. And I think, I'm sorry, what was the other one, the county board, and was there another one?
Other county officers.
Oh, other county officers. Yeah, same thing, like, working together, the coroner's office uses each office. Fortunately, not every other office needs to use the coroner's office, but you do have to have that good working relationship and, be professional and transparent, be transparent.
Okay, thank you. Mr. Williams, what do you think the relationship ought to be between the coroner and the county board and the coroner and other county officers?
Well, obviously, in a perfect world, we want everything harmonic and everything to work smoothly. But ideally, being the coroner, sometimes you have to make tough decisions. And you have to be honest with both and be able to let them know different things. And so I would say, great. Let's have a great relationship. But when it's time to be serious and let county board know or any other entity know the things that need to be said, and for the bigger good of the county and the citizens of the county. And so, obviously, I want to get along with everybody, but I think for the bigger good of the community and the citizens of Champaign County, you have to sometimes be the bad guy.
Okay. And Mr. Williams, the coroner's office works a great deal with first responders. And could you describe whether there are ways to improve those relationships?
So first responders, ways to improve those first responders, obviously not being in the office right now. So knowing all of the entities, but definitely working with law enforcement, other agencies, state's attorney, just building those relationships, having trust. Trust is major. Being able for folks to be able to trust in your professionalism, and your honesty, and you being upfront. So I think that's major, and I think that that can be done. We've done it before through our community involvement, and I have a great relationship with law enforcement, a great relationship with the state's attorney's office, and I look forward to working with those men and women to be able to better serve the Champaign County and community.
And Ms. Brower, the coroner's office works a great deal with first responders. Do you have ways that you might improve those relationships?
Absolutely. I've been a first responder for 35 plus years. There's a lot of ways that we can better our relationship. Training them or talking to them. And I'm going to add in the hospital staffs to this as well, not just first responders, but letting them know what to expect from our office, what they can expect when they call us, what information that we're going to ask them for. Right now, it's kind of inconsistent, and fortunately, not every one of the first responders or hospital staffs, talk to us. That's a good thing. So when they do talk to us, it should be a comfortable experience for them as well. It shouldn't be an unpleasant experience when they talk to us. I want to help them understand what we do and the information that we need from them, and that'll make the process so much smoother.
Okay, thank you. And this is sort of a question off the top of my head. You mentioned, and this for Ms. Brower, you mentioned the pathologist and that you don't currently have a pathologist. And what impact does that have in the office, and how would you be going about trying to correct that?
Yeah, so the position is posted. They have, they are looking for someone now. How it impacts us, we're spoiled. Not every county has a pathologist. There's a lot of counties that don't. That's why we did and still do autopsies for other counties. What helps us, and I guess we got a little spoiled by having our pathologist, is we can go back and see that autopsy. I can go back and see the autopsy that's happening on my case, or if it's a case that I was interested in, I can go back and see that. That's immediate. So right now, one of our issues is transporting those bodies to the other county to have those done. We don't get to see it. We have to wait to get the preliminary report. It is usually that same day. So, there's not a huge delay in that. But I think that there is, a little bit lost in not being able to just, walk down the hallway to, talk to the pathologist, if I have questions.
Mm-hmm. And Mr. Williams, as I guess I've learned, the county doesn't currently have a pathologist. And how does that impact the office, and what steps might you take to correct that?
Try to increase the capacity and working with the executive board, like we talked about, being able to encourage them to be able to feel the need of getting us a pathologist. Our county needs a pathologist to be able to continue the work that the great work that we've already been doing in servicing other communities. We lose revenue by not having a pathologist. And so, like my opponent said, being able to have that in-house is direct, because any investigators that's investigating those particular deaths have that person in-house that can educate them and inform them and be better there to investigate and be able to help us perform the duties and get these death certificates out in a timely manner.
And Mr. Williams, my understanding is that the coroner's office has the responsibility for all deaths in the county, and because there is a major hospital in the county, that's more perhaps than just county residents. Are there advantages, disadvantages to having such a major hospital in the county?
It's a huge advantage to have the major hospital that we have, trauma center here within our community. But being a separate entity, being able to provide those services that our county coroner and our county pathologists have done for us for years, we don't have the power, so to speak, to be able to control what that other hospital does, but we can control what we do in our office. And so that's a major reason why we need our own pathologist. We should be a separate entity operating separately from our major hospital.
Ms. Brower, it's my understanding that the coroner's office has the responsibility for all the deaths in the county. And because we have a major hospital in the county, that's many more than just county residents. And how does that impact? And is there any way to ameliorate that or handle that?
Yes. So actually, Carl is a huge resource. I am so thankful that they are in our community. They're a huge asset to our community. It does bring in a lot of people that live outside our county. What that does to us sometimes is if it was what could potentially be an accidental death. We have to go to that outside county to get the EMS reports and then a police report. We have an excellent relationship with all of these departments and can usually get these reports as quickly as we need them. I will state though, the majority of the deaths in the county are reported to the coroner's office, but are not coroner cases. So not every death is a coroner case. A lot of them are medicals.
Okay. Ms. Brower, do you have any recommendations for legislative changes which could improve the requirements and limitations under which you currently operate?
Yes, actually, I have one that there are other states that allow mid-level providers to do autopsies. There is a lack of pathologists in our country. There are not that many. That's why the job postings are many compared to the amount of pathologists there are. Having mid-level providers capable of doing these autopsies would be so beneficial to the counties.
Okay, and Mr. Williams, do you have any legislative recommendations or changes which would improve the requirements and limitations under which you currently operate?
Like my opponent just said, I mean, we are short. We do have a shortage. It's only 500 pathologists in the whole country, and so only 18 graduated from school this past year. And so every county needs a pathologist, and so the supply and demand there. And so we definitely need to educate, and we need to get more people an incentive. So my legislative appeal would be getting more people incentivized through legislative measures to be able to fill the void of this extremely strenuous need of pathologists and other healthcare professionals throughout the country and also throughout the state.
Okay, that comes to the end of my questions. So we have closing statements, and and since Ms. Brower opened, Mr. Williams will close. So Ms. Brower, you have 2 minutes for your closing statement.
So I just want to reiterate my opening statement. Thank you very much for giving me this opportunity. I love my job and I love talking about it. You can ask anybody that asks me about it. I kind of don't stop talking. My experience makes me the perfect candidate for this job. Between my healthcare experience, my law enforcement experience, this has come together. What started as, making me absolutely love this job. I feel like my two worlds have collided and I love my job. I've been for over 2 years, so I have a lot of things that are ready to go once I get the office. With my institutional knowledge and my experience that I'm bringing with me, it just, makes me the perfect candidate. I want to bring transparency, efficiency. I want to bring more compassion to our office. And I think that I am the perfect candidate for it.
Thank you. And Mr. Williams, 2 minutes.
Yes. So obviously, just being in business for myself for many, many years and being at an executive level, working with city officials on the various issues that absorb our community. And so what I'll bring to the table as being Champaign County Coroner is being able to leverage all of the relationships that we've already built to be able to educate, once again, to be able to diversify the coroner's office and to be able to help with some of the trauma support. I'm already working with women, the women from gun violence. And so I meet with 22 women every Tuesday night with trauma and resilience in the community, with help of them better understand what happened to them better understand how to move forward. And so, and this is, I don't get paid to do it. That's just an extension of what I want to do with aftercare, to be able to reach those families, so that we can prevent any retaliations and we can prevent deaths. And so that's just the passion that I have for our community. I've had that for many, many years, since I was 17, to be able to serve our country the best way that I possibly can, and to be able to leverage my funeral home experience, working with families on a daily basis to help them with understanding things like estate planning, and my insurance knowledge as being a licensed life insurance agent for the last 13 years. How do we be able to cope and be able to help them provide informationals to the families so that they can be able to move forward. So I thank you for the opportunity tonight. And yes, thank you very much.
Okay, thank you both. Again, thanks to the League of Women Voters of Champaign County and the NAACP for sponsoring this forum. The recording can be found. The recording will be posted in just a day or two, very, very quickly. Can be found at votechampaign.org and on the League's YouTube channel. And both of those can be found on the location of both of those can be found on the League's website. They have links. Special thanks to Michelle Cooper, who always steps up to be our timer and keeps us on schedule. And just a reminder, it's not too late to register and to vote. You can register all the way up to Election Day, which is March 19th, and you can vote that same day. So information is available on the League website and the county clerk's website about how to register and vote. So please vote. Thank you very much. Okay.
Thank you.